Good afternoon, and thank you for the invitation to join with a video presentation. I'm sorry that I could not be with you, but a year ago I have arranged a symposium with the students here at the hospital. But Karen Sipido convinced me that you would welcome a video intervention from me, and I do hope it's not a waste of your time. First, I would like to compliment the Science Panel for Health with the position document. I couldn't agree more. It's an excellent and important document with all the right arguments and proposals. The important thing now is how to take this document and the proposals forward. Who sets the agenda? In the old days, it was the researchers and clinicians at the university hospitals, and we are still an important driving force with the learned societies, international conferences, peer-reviewed journals. Previously, it was a physician-led area. Nowadays, it's more interdisciplinary with science, physicists, engineers, big data, medicine, ICT, social science, humanities, nurses, midwives. The University Medical Centers of Europe are responsible for more than half of the publications in biomedicine and health. The research is typically arranged according to the specialties, cardiology, oncology, pediatrics, more interdisciplinary nowadays with convergence between the areas. Demands for high clinical efficiency and economic constraints have in some countries led to a decline in clinical research, and industry-sponsored trials have moved to the east. Hospital administrators and owners have their visions for how to direct and influence research. The same with politicians and other decision makers. In some countries, strategic top-down research is important. In other countries, the arm's length principle is still in place. A combination of top-down and bottom-up research is best. The public national funders like the MRC, Deutsche Forschungsgemeinschaft in CERMC and RS are key stakeholders with researchers and scientists on different advisory boards and committees. Strong individuals can have a market influence on how research is developed. The European Commission, Horizon 2020, the ERC program, EIT, have improved biomedicine and health tremendously in Europe with global footprints. In the US, they are also privileged having the NIH. In Europe, we have private foundations as they have in the US, the Wellcome Trust, the Novo Nordisk Foundation with important influence if they are very big. In Denmark, we have an ongoing discussion about this because the very powerful foundations influence the national research agenda. They are, in my opinion, important, positive and useful because they can be more daring and more risk-taking. In the US, they have had a tradition for engagement of patients in research through the last 15-20 years. And in Europe, it's being strengthened, as Anders Olafsson has reported on your conference today. Great respect to Anders. Here in Denmark, we have patients in the ethical committees, and it would be even better to engage patients also in all kinds of research planning and prioritization. For innovation, new products, economy, the key stakeholders are, of course, the industry, drug companies, medical equipment, ICT. Private-public partnership with transparency, good rules, research integrity, and a mutual goal is crucial. The innovation climate is improving in Europe, but we have a problem, the valley of death, with lack of venture capital for making research into real products and new industry endeavors. For all the different aspects, the key word is quality. Since Aristotle in the old Greek world, meritocracy has been the argument for choosing a person for a task. That's why we are so occupied with ex ante and ex post evaluation of research, because we want to pinpoint quality to be sure that we give the money to the best. Quality is a good predictor for future transformative and important research. Who sets the agenda? It's people like you and me. For us with a certain influence, it is especially important to be careful, not only occupied by one's own field. The cardiologist will think about the heart, the oncologist will think about cancer. That is understandable, but the more responsibility the higher need for seeing the big picture. We have to leverage the whole area, and we have to do it by collaborating with the rest of the world. In our department, we collaborate with several centers in Europe, but also with the US, China and India. It is important to choose the best collaborators, no matter where they are in the world. It is difficult to predict, especially about the future, unless you design it yourself. We have to be humble, but also daring at the same time. We need to engage the young, the brightest, the creative, the new wild ideas, thoughts and concepts we did not even know that we needed. When I was chair of EMRC, our forward look reports had some success because we tried to think out of the box and very far ahead. Calls, applications, peer review, funding, performing research, publishing, meta-analysis, health technology assessment guidelines, and first, then implementation into clinical practice. Foresights for medical research need to pinpoint what we need in society 5, 10 and 15 years ahead. What do we need and where are the big challenges? In Europe and globally, we need to work in an interdisciplinary and collaborative mode due to the big data revolution for personalized medicine, stratified medicine, precision medicine. This is clearly endeavor number 1. Infectious diseases, Ebola, SARS, new diseases we don't even know now. Bacterial resistance, we have it in our hospitals all over Europe. It is spreading. We need new antibiotics and new ways of treating bacteria. Migrants and refugees in Europe create new challenges. Diseases, not frequent here, infectious diseases, mental health disorders, healthcare problems for children and adolescents. It creates stress and mental health disorders also among the receiving populations due to fear. Prevention for all areas, healthy aging, no tobacco, little alcohol, physical activity, healthy food, hopefully a happy life, and a crash helmet when you go home on your bicycle. Green and sustainable solutions in biomedicine, chemical pollution, brain development in children, clean water. Facebook, Twitter, YouTube, smartphones have already transformed our world. We are actually in the middle of a revolution. Research should address this and combine it with prevention. Patients and relatives should be in the driving seat together with politicians and other decision makers and the researchers so that we help each other, take responsibility and see the big picture together. So, who sets the agenda? We do. And the responsibility is huge. To the Science Panel for Health, we expect a lot from you. In the advisory group, we will look at the short-term concrete calls, but you have the responsibility for the future. In Europe, we are diversified, heterogeneous and fragmented, also across the different key stakeholders. The European Commission framework programs have improved the situation, but we are still not there. The first step of a solution could be an open access house for biomedical and health research to strengthen health and innovation by engaging science, patients, the healthcare sector and the industry. Not an NIH for Europe, but a true European solution with a network and a house or location for advice, information, coordination and implementation. European policy and strategy, EU and member states, scientists, funders, patients and industry. For big ideas and projects. Priorities, opportunities, needs, collaboration, synergistic, complementary to the framework program and ERC. With quality, accountability, continuity and flexibility, and on a voluntary basis. We need to collaborate across borders. We need to create coherence instead of fragmentation. We need to leverage the whole of Europe, and we need to unite research from basic translational and clinical into implementation and patient treatment. The house could be in Brussels and also be a network, as proposed in the position paper. A house, a place where we could all meet, the European Commission, the Biomedical Alliance, other research organizations, and the public funders, the private foundations, patient organizations and industry. Science Europe has a new organization with no specific medical committee. EMRC is closed, so it is more important now than ever that all stakeholders in biomedicine and health have a place to meet and collaborate. Perhaps the fine small house at the Belgian Royal Academy. We need to team up and be smart. The physicists in Europe have teamed up for CERN, ILL, ESRF in Grenoble, PSI in Switzerland, the huge ESS in Lund, DC in Hamburg, Jules Horowitz and ITER. The crisis at the moment for Europe will be serious for science, but especially for biomedicine and health. We do not have a strong organization for all key stakeholders. We need to unite and fight together. We need to have a base, a network, perhaps a place, a house. We should team up for a landmark solution for biomedicine and health, for patients and society, and thereby for all of us in Europe. Thank you very much for the invitation. All the best, and also for the rest of the day. Bonne chance.